Hi, and welcome to Tebra Talks, the podcast for people that are keeping independent healthcare thriving. I'm Samantha, and I'm a product marketing manager here at Tebra. We talk candidly about the realities of running a practice, what's changing, what's working, how real people are navigating it all while keeping their doors open. And this show is brought to you by Tebra and shaped by the people who are running the business of care, because what happens behind the scenes matters just as much as what happens in the exam room. And I have my colleague Hannah here today. And Hannah, if you can introduce yourself.
Yes, thank you, Samantha, for that introduction. I'm Hannah Abrams, the product marketing manager on Tebra's clinical side. And today I'm really excited because our last episode, we chatted through AI. What's real? What's just hype? Where are we at with AI in healthcare? And that was just an exciting opportunity for us to double click on the automation piece of AI and how that's the true unlock when it comes to AI for our private practices. But today we're going to talk about something a little more specific that we alluded to in our last conversation, and that's how to spot the wins. So, whether they come from AI or not, and why improvement actually starts with getting the basics right. So, this is super important, and we're going to delve into what that means. So, for providers, improvement often means the same four things. At least, this is what we typically hear from our providers repeatedly. So, they're looking for less time in the EHR, fewer pajama notes, AKA after hours documentation, reduce staff workload, and happier patients, which we love to hear. We think that's super important as well. So the opportunity here for improvement is massive. So we did some internal Tebra research of our providers, and we learned that 53% of our providers spend 90 plus minutes a day documenting, and 77% spend another 90 plus minutes after hours. So that's an entire extra shift spent typing instead of caring for patients. And, of course, I'd be curious to know from anyone listening, when's the last time you looked at your workflows and asked what's actually working and what can be improved? Chances are there are several things that are going to make your day to day and, your relationship with your patients that much better. And they're not necessarily huge taxing workflows that need to be restructured. They're often simple improvements. So we're going to talk about what that means and kind of how you can get started with that.
Yeah, and just I mean, we've talked about it already so much, and I feel like we both can talk about this forever, both from the patient perspective, but also from a people supporting healthcare practices. But the nature of AI is like so situationally valuable, right? Like we've talked about, you need the foundations in place, you need the basics. AI can be transformative, but again, it's only if those fundamentals are in place. So previously you had talked about AI Note Assist and how, to begin with, practices need to be implementing workflows within the EHR, within the note, to ultimately unlock those huge 50 to 70% time savings that you mentioned, which is still haunting me today because that is a ton of time. Like, as a former medical scribe, it's like, wow. That ambient listening example, again, it's about having that foundation of having access to the note, which means you need to have that integration within the EHR in order to add time savings. Otherwise, you're doing that copy paste flow. That's more admin work. And even in more of the patient experience and patient engagement space, there's a huge trend that's starting. I'm getting pinged about it all the time. We're looking at it for forward roadmaps, really evaluating, is this the right bet? The trending solution of voice AI, and having that integrated within the EHR. Is it building a to-do list, or is it actually taking care of these tasks? So, what I'm thinking of is, if I call a practice and, hey, if I'm an AI and I'm figuring out what a patient needs, am I just now building a to-do list for someone else to do? Or am I actually going to schedule the patient? Am I actually going to tell them, hey, like, visit your patient portal in this area in order to look at, your lab results, or whatever that may be. And obviously, there are going to be iterative approaches, but it's really important to take in that situational context to really acknowledge the total value. I actually have two great examples, and these are more forward thinking, but two case studies where AI didn't work because they were added too soon. We've talked about the hype of AI, and I think an AI scheduling assistant is like a great example. I think it could do wonders for the practice. It's one of, the top requested items. We mentioned before in the Tebra survey how 65% of providers think that would actually help them in their workflows. But, in the case of a mid-sized dermatology practice, they're like, hey, we're going to be innovative. We're going to introduce this AI scheduling tool. It's going to promise intelligent booking, patient demand forecasts. The idea is great. The values they're looking for and the benefits are, hey, we want less no shows. We want help balancing the calendar. We need someone who is saving the front desk time instead of relying on a group of hyper organized people keeping the flow going who are stretched way too thin. And ultimately for them, what went wrong? Well, the AI was layered on top of their existing system before the practice had even standardized appointment types, lengths, provider availability rules. So this is all living in someone's head, but it's not within the technology themselves. And so as a result, this like AI scheduling agent started to double book slots. It started shoving cosmetic procedures in time windows that were meant for urgent biopsies or more clinical items. And so then the staff, instead of saving them time, it then required more time from the staff to untangle the mess. They're then also having to call patients being like, sorry, we had an error. We need to make an adjustment, which I don't know, more so from the practice perspective, as an admin who has had to make calls like that. Number one, you're like, I have to say yes to whatever time slot that you need. And we just have to make it work. So then you're then putting that strain on the staff and providers in order to save that patient relationship that you've then just put at risk. It's not that that tool wasn't valuable. It's just that they wanted that self-driving calendar, but they forgot to pause, pave the road, make sure it's all steady before getting that car going. And so I think it's examples like that where it's a hype and the expectations need to be set realistically, but also we need to be situationally aware of, are we implementing it at the right time? Are we implementing the right solution? And are we implementing it contextually where it's going to provide benefits to our patients and our staff and our providers, right? And I think, we could go on with examples like an AI billing bot that is going through patient messages, but can't speak healthcare. So if they think that Medicare and Medicaid are the same thing, those are huge implications, right, from a billing perspective. And I can tell you when I first got in healthcare, knowing all the different insurances, all the different plans, what that meant, what actions to do, those are very important when handling things, especially dealing with patient finances and practice finances. AI can save a lot, but you've got to have those foundational things there and you got to be really intentional and really aware of what solutions you're implementing and if your practice has the right, foundations and fundamentals set in place.
It's so, so important what you just said. And those examples were really great for crystallizing just how common of a pitfall this can be and how big of a deal it then is. And I think it's so tempting to just want to start using these AI powered workflows, start taking advantage of the time savings. But like, if you don't do it right, it can definitely end up causing more time needed on your staff, more of a clunky patient experience. You really hit the nail on the head, just how important it is to get your foundation straight before moving on to, what we could call the advanced course. And I don't think that's like a groundbreaking idea. It's like was an athlete and you can't learn to shoot a three-pointer until you nail your shooting posture and you can't learn to play Beethoven until you get your scales down. So it's no different here. If you want to take advantage of some of these more advanced workflows, it's really important that you set yourself up for success. And then once you do that, you're golden. But take the time to do it now before it becomes even more of a headache in the future. Just some things that come to mind in terms of like those foundational EHR aspects, since I do work on the clinical side. So I can tell you what we see is super important to have in a good place before you start bringing AI and automation into the fold. Some of those table stakes features in modern EHRs, the fundamentals, before you bring in AI, make sure your foundation is strong with Switch from paper scripts to e-prescribing. That's huge. Use an integrated telehealth solution instead of juggling multiple vendors. Just make your life that much easier. And then if you want to involve an AI scribe in that, you can then use it in both your telehealth and in person office appointments. It's going to be that much easier. And then finally, I know Samantha's touched on this already, but enable online scheduling instead of relying only on the phone. So when those basics are solid, AI then can become an accelerant, not a band aid, or worse, a deterrent. And just to kind of drive that point home, so those foundational upgrades limit the returns you'll get from any advanced tools. So let's say a family medicine clinic adds AI powered charting. Now visit notes are drafted instantly. That's great, but here's the problem. The practice still relies on phone only scheduling. So that means patients spend 10 to 15 minutes on hold just trying to book an appointment. So while the provider saves 7 minutes per visit with the AI charting tools, the practice as a whole is losing 20 minutes at the front desk for every patient who calls in. So if you look at the net effect of that, the time savings from AI never actually then reach the patient. They're swallowed up by inefficiency and another part of the workflow. And if that practice had rolled out online scheduling first, then layered AI charting on top of that, the gains would stack instead of cancel out. So we're talking fewer phone calls, smoother scheduling, faster notes, and of course, the best part, happier patients.
I love how you just went into that in a holistic approach. I think this is a really common trend in medicine, right? Where it's like, let's just not assume because my arm doesn't feel right that like I hurt just my arm. Let's do our broad line medical lab tests, general blood panels, et cetera. And so I think really how practices should see approaching business problems is very similar to how they approach healthcare problems. Let's take a look at the holistic approach. We know that this particular area, we need extra emphasis, but are we doing things across the board? I'm a perpetual not water drinker. I am perpetually dehydrated. And so, generally, whenever I have any medical issue, my first response before even going into the doctor is how much water did I drink today? And I think like that's a great example of, are you getting the basics? Are you eating? Are you drinking water? Are you still breathing? Like, do you have those fundamental basics down? And are you doing that for your business? I love how in our past podcasts I have mentioned like the provider and the patient aspect. And I think you broke it down perfectly where, you're addressing all these things for the provider in this one silo of function. But when you zoom out holistically, you're losing all those aspects of the patient gain that you would have had. And that's just because you're creating these other limited reagent type things where you're not getting enough in one area and it's gobbling up all of that productivity that you would have otherwise had. And that I think really just compounds the intense pressure and need for healthcare businesses to really unlock and compound AI with automation wins. Talk about your AI Note Assist, but then you also talked about e-prescribing. Let's take it one step further. Let's have the integrated lab ordering. Again, we should not be sending patients out with pieces of paper. No lie, on my fridge, I have a lab order that has been on there since February. So it's, things like that where it's like, I'm not holding myself accountable and I'm just lucky that I put it on the fridge. Otherwise, I would have lost it. And to that point, having all of these things integrated for the practice creates a smoother patient experience. It also helps with healthcare outcomes because you're leading things to faster turnarounds, hopefully a faster diagnostic turnaround, and then you can address things with your patient while also having the full comprehensive view. And that's just on the care side. Now, how do you get patients in the door, right, in the same fashion? Are you having that online booking available? Are you having automated appointment reminders? Are you having some sort of digital intake? So that way, patients aren't just sitting in your waiting room spending another 15, 20 minutes. There is nothing that irks me more than those reminder texts that are like, hey, come 15 minutes early to fill out your paperwork. And for me, I'm like, from a patient experience, I'm putting the digital part and I'm getting a tease of it. And then I'm like, hey, I've been now catfished to go back to paper stuff. So the idea is if we're doing it in total, right, we're seeing those huge outcomes. So from an admin side, we'd probably see fewer no-shows, faster visits, just happier patients, and I would say overall a higher lifetime value, right, of a patient because they're willing and able to come back. They're confident in not only the care they're being provided, but the experience that they have end to end, whether that's through text message, through the patient portal, with the staff in person, what happens after, are they being heard after the visit on their reputation surveys, and really you've talked about this copy paste, right? In the sense of the AI notices, but that really can apply to every single function that a practice is doing, right? Use the copy paste test. If you're still manually moving data, whether that's the actual note information, whether that's a patient's email, whether that's a patient's text message, whether that's, hey, here's your like appointment information, your tech stack is not doing you justice and it's not working at the full capabilities. And so we cannot hone in on this more. Just AI and automation is ultimately your full unlock. And it does require a little bit of confidence, right, from the practice and a little bit of due diligence, right, and making sure that you're validating, doing your research, really understanding how these solutions are working, how it works within your workflow, or how you may have to modify your workflow to make it really work in your favor. So it's not that we're asking for full control with AI or automation. It's that we're asking for control for the things that you shouldn't be having to do in the first place. And it takes a little bit of faith and a little bit of due diligence and a little bit of research. But, here at Tebra, I think we're doing a great job of providing that integrated experience first and foremost that I think a lot of solutions and piecemeal competitors are really ignoring. They're saying, hey, just go integrate with this company, integrate with that company, and do that. But when it comes down to it and your practice runs off of all of these platforms and then you have a bug or a break and you're seeing, 50 patients in that one day, what are you going to do?
So many good points, Samantha. And I think, you brought up, of course, the copy paste test. And I think, we know how inefficient that is, but also it does kind of open the floodgates to increases in mistakes. Like I've been in doctor's appointments where they've come in with a chart thinking I'm another Hannah and they're asking me how it's been going with my diabetes medication. And I'm like, I don't have diabetes. Like, not a good way to start a
Mhm.
treatment. And if you have these integrated experiences instead of these clunky tech stacks, you're going to cut down on that aspect, which, of course, understandably is not an ideal patient experience. The other thing I wanted to call out, I'm going to start like with a bit of a bad news, good news. So the bad news is if you don't have these foundational aspects in place, the gap is going to widen as we continue to see innovation across AI. So what do I mean by that? If you're still sending paper prescriptions and printing out lab work, we're going to get to a point where AI is able to automatically queue these things up, save you even more time. So if you don't have that in place, like you are not going to be able to take advantage of those workflows. And it's just going to get even wider from there. So again, we've said it before, like we are at the beginning of this. This is a good time. Here's the good news. This is a really good time to get those foundations in place. So it might sound like from this conversation, if you don't have all this set up, you're behind, but that is not the case at all. There are a lot of practices doing things on their own timelines. We know there's a lot of kind of hesitancy around AI. That's fine. Like go with it at your own pace, but like get those foundations in place right now. Like this is the time you want to do that and it's going to pay off for you very much in the short and long term. So we can't really stress that enough.
I mean, I got some bad news to add to that,
Oh,
right? Like
Samantha.
that's just measuring on your own, efficiency. You then think of the doctors in your local and competitive area. And I mean, from the patient experience side, I look at a lot of our marketing solutions and it's like, cool, like if you're not optimizing for this AI world, that's your choice. But guess what? When I'm seeing that 45% of practices are already investing in this, local SEO and GEO, which is, more on the AI side, right? Like it's now unfortunately becoming a competitive arena where if the patient experience is getting so drastically better because one practice is implementing AI and the other one isn't, over time, if you're still stalling, at some point, patients are going to pick up and being like, I heard from my friend that this person, they had an awesome experience and I'm going to switch over there because I cannot be tempted more, right? And so I think that's really important to consider, especially as people who are in the millennial generation or younger generations who are just so tech forward. They're
Yeah.
also helping to manage and coordinate care for, their parents or elderly family or loved ones, right? Like they're the ones who are now making decisions based off technology. And so the competitive edge just becomes a little bit sharper
Yeah.
from an efficiency and from a patient experience standpoint. So that's my bad news is take your time, but make sure you know your trade-off of taking time, right?
Yes.
So
So sorry everyone for the bad news sandwich, but we want you to understand the state of the state. So that's a really important call out, Samantha. Like we can't take competition out of the equation. If you're behind in something, someone else is going to be at the forefront of it. And it might not be a huge deal right now, but it very soon, I think, will be. So again, great time to get on board with the fundamentals, the foundations across your clinical workflows, your patient experience workflows, practice management, marketing, et cetera, et cetera. But if we were to kind of crystallize that into a nugget of advice, so again, start with the basics. Then step two is layer AI on top of those basics. And we don't want you to leave this conversation overwhelmed. So often our advice for our providers is just start with one aspect. Just start with one, whether that's setting up your e-prescribe or, you know, something over and getting your online scheduling set up. Like just begin with one and see how much better that makes your day to day. Like once you have the confidence and your staff gets on board with how much time it's helping them save so they can focus their attention elsewhere, it's going to be that much easier to then roll out these improvements across the board. So keep it simple, start with one, see how that goes. That would be our advice for you.
I love that. And I love how you just ended our conversation, Hannah, where it is ultimately about taking that first step, right? We don't worry about the next step until we got that first step. So I could not agree with you more. Practice is just taking that one aspect, whether that's on automation, if that's appropriate, or if that's AI, if that's appropriate, or maybe both. Maybe you do a combo big step, right? You have to make sure your foundations are there to begin with. And, it could even be that your first step is just doing an audit of where you're spending the most time. I bet you there are a good amount of practices who think they know, but they got to source all their staff, right? They need to really understand end to end where they're wasting the most time because otherwise patients aren't getting that end result. Um, Thank you, Hannah, so much for joining our continuation chat today. It's always exciting chatting with you. And I'm really excited to just see not only, what more we have to say, but how Tepra is going to really help fill that gap and meet the expectations of really providing patient centric care at the forefront of these practices. So, thanks all.
Love that. Thank you. Bye, Samantha.